Hello, I'm Dr. Marla Shapiro, and I'm a past president of the North American Menopause Society. And I'm so pleased to be joined today by Dr. Ekta Kapoor. She is at Mayo and is a board certified endocrinologist and menopause specialist. She's also an associate professor of medicine at Mayo Clinic in Rochester, Minnesota. And today, for women who are listening, there's a lot of confusion about the age of menopause. So, a lot of women think that it can happen in their 50s, but we have women who are in their early 40s or even earlier. And can you sort out for us the difference between women who are menopausal when they're 52 as opposed to women who are menopausal in their fourth decade?
Wonderful. Very, very important question, Dr. Shapiro. So the average age of menopause in our country is about 52 years. In our continent, I should say, North American continent, it's about 52 years. There are consequences if a woman does not go through menopause in the normal age range, which is about 46 to 55 years, that impact her long-term health. So that's why this distinction of early and premature menopause and age at menopause is a very important one. It's not just loss of fertility, it goes beyond that, as I will explain. So if a woman goes through menopause because her ovaries quit working for any reason, prior to the age of 40 years, that is premature menopause. But if the ovaries quit doing what they're supposed to be doing between the ages of 40 to 45, that qualifies as early menopause. And like I was saying, that we make these distinctions not just for the fun of it, but because the younger a woman is when she goes through menopause, not only is she losing her fertility potential, but more importantly, she's losing that vital hormone that her ovaries make, estrogen, which is so important for her long-term health. So when she loses this estrogen earlier, she's at a higher risk for heart disease. She's at a higher risk for osteoporosis and fractures. She's at a higher risk for cognitive decline, potentially dementia, and even dying early. So some serious consequences of going through early menopause, premature menopause. That's why as menopause practitioners, we make a very big deal about it and are proactive in taking care of these women.
So if I'm a woman in my 40s, and my periods start to get somewhat irregular, and then I don't get a period for 3 or 4 months, is that, a ringing bell that I should be seeking healthcare?
Yes. So anytime the cycles change patterns, I think healthcare should be sought. And then a younger woman is, then more the reason to worry, I guess. Now in 40s, the nuance is that we also witness what we call the so-called perimenopausal phase, that a lot of women start making transition towards that natural menopause, which in some women can last for years, actually. So that distinction is so hard to make, whether she's begun her journey early on for that natural menopause, or are the ovaries going to shut down in the near future? So I think that can be a very nuanced and intricate discussion with their provider, but absolutely attention should be sought. And the provider would probably take a detailed history and do the necessary tests, which are not the same for everybody. Again, it's a nuanced approach, but absolutely seek attention. And especially if that's accompanied by symptoms of menopause, like, hot flashes, night sweats, sleeping difficulties, brain fog, etc., then all the more reason to seek attention.
So one of the questions, I guess, for women is that if in fact they've lost 3 or 4 cycles and they go and see their healthcare practitioner and the discussion about an early or premature based on their age, menopause happens, is there ever a possibility that things could just resume spontaneously again?
Absolutely. That's such an important point to bring up also. Yes, that happens all the time. So it's not a trivial number. Up to 10% of women who've actually been given that diagnostic label of premature menopause will resume cycles, and they will resume to the point that they can even get pregnant. So I've seen it in my practice. I've seen with friends and family where someone was told that she need not be on contraception because the ovaries are not functioning the way they are supposed to. And lo and behold, spontaneous pregnancy. Now, for some people, that's a good thing, but some people do not want that to be the outcome. So I think that's a very important discussion to have with the patient.
So for many women, there's so much confusion about estrogen, and many women just look at estrogen as, oh, I don't want to be on this. This is associated with cancer. But can you highlight the importance for women who truly are premature in their onset of menopause and the loss of the estrogen, why this is a group that is completely different than a 50-year-old who is now entering menopause?
That is such an important question, Dr. Shapiro, and one of my pet peeves. And this is something I talk very passionately about to my patients and, to the other doctors that I'm talking to, that when I see any patients with premature ovarian insufficiency or premature menopause for the first time, the number one counseling point I make to them is that do not exchange notes with a woman who's gone through natural menopause. The hormone therapy rules, the benefits of it, the risks that you might expect, just do not apply to you. So,
Right.
if your 55-year-old friend is telling me that she's stopping hormone therapy because she's afraid she might get breast cancer, fine. But that should not be a reason why a young woman should be stopping it, because it's a completely different ballgame. And the way I like to think about it, that in these women, it's truly replacement therapy. So the
Right.
analogy I give them a lot of the time, that if your thyroid gland is not doing its job for any reason, or it's taken out, we give you thyroid hormone back. It's kind of a similar situation, that your ovaries have come out or they've quit doing their job and you've lost that vital hormone estrogen, which is important for your long-term health. We give it back to you. Unless there is a reason why it's been medically determined that estrogen is unsafe for you, which sometimes happens in women with breast cancer where we don't want them to be on any estrogen. But outside of that, there really should be no reasons. I tell my patients, don't let anybody touch that estrogen unless they have a very, very good reason to do it. And you should be on it till you attain the average age of menopause, which is about 51 to 52 years at the very least, because the goal is not treatment of symptoms. The other important thing that I see, and I'm sure you've seen in your practice also, women will stop taking estrogen because they're not having symptoms. They were like, I wasn't having any hot flashes and really nothing going on, so I figured I didn't need the estrogen. But again, that analogy does not apply to these young patients, because the goal of treatment is not just symptom management. It's a much bigger goal there.
Right.
To prevent the long-term risk. So I tell them that please stay on that. That's my most vital message.
Well, and I think you're right. I think for women who are listening to us today, it's really vital to understand that when you enter menopause and we talk about hormone therapy, it's not the same as a younger woman who truly needs those hormones replaced until the natural age of menopause. It's not about symptom control. It's about prevention of long-term disease.
Exactly. Exactly. And for the same reason, I tell them, Dr. Shapiro, that don't exchange notes with older women who will be on lower doses of hormone therapy. And that's okay. That's right for their health. You will need higher doses. So we'll be following a completely different program. So consider yourself very different from that patient population.
And I think that's a really important message and an important note to end on, that if you are a young woman with early or premature menopause, have the conversation with a healthcare practitioner who's trained and that you trusted, hopefully NAM certified, can really give you advice that's really tailored to you as a woman. Thank you so much for joining us today.
Thank you, Dr. Shapiro. My pleasure. Good to see you.